As the warmer months roll in, the increased outdoor activity presents a higher risk of encountering mosquitoes and ticks, both of which are known vectors for a range of dangerous diseases. While the risks posed by these insects may seem manageable, the reality is that the diseases they carry can have devastating consequences if left undetected or untreated. Lyme disease, West Nile virus, and a growing number of other infections continue to spread, and what should be a carefree summer outing can quickly turn into a serious health scare. It is crucial, therefore, to not only take steps to prevent bites, but also to be hyper-aware of the signs that could indicate a far more severe illness lurking beneath the surface. One of the most common tick-borne diseases, Lyme disease, has seen a disturbing increase in cases in recent years, a trend that should alarm anyone who spends time outdoors. While Dr. David Quimby, an infectious disease specialist with Chi Health, notes that the risk of infection is reduced if ticks are removed promptly, this does not lessen the overall danger. The idea that one can simply remove a tick and go about their day without concern is dangerously simplistic. While Lyme disease may not take hold immediately, ticks can carry other diseases that present a much faster and more insidious threat. The longer a tick remains attached, the higher the likelihood of transmission, and many individuals fail to perform thorough tick checks after exposure, missing crucial signs of infection until it's too late. Moreover, tick-borne diseases like Lyme disease are not just confined to remote forests or wooded areas. As suburban and rural areas expand, the risk of encountering ticks increases, making even seemingly benign nature walks hazardous. The symptoms of Lyme disease, such as a bullseye rash or fever, often do not present themselves immediately, and by the time they do, the infection may have already progressed. This delay in symptoms means that many people do not seek treatment in time, resulting in chronic health issues that are difficult to treat and often lifelong. Equally troubling is the rise in mosquito-borne diseases such as West Nile virus, which can be just as devastating. The virus, transmitted by infected mosquitoes, can cause encephalitis, a potentially deadly inflammation of the brain, and can lead to permanent neurological damage or death in severe cases. With warmer climates and increased rainfall, mosquito populations thrive, exacerbating the spread of diseases. It's essential to remember that while mosquitoes are often seen as a mere nuisance, their bite can be far more dangerous than most people realize. Increased exposure to these insects, particularly when engaging in outdoor activities, further heightens the risk. The public often overlooks simple preventive measures, such as applying insect repellent or wearing long sleeves and pants when venturing into areas with high mosquito or tick activity. Despite widespread awareness campaigns, these precautions are not always followed consistently, putting both individuals and their pets at risk. Many people underestimate the risks of Lyme disease and West Nile virus, dismissing the severity of these conditions until they are personally affected by them. This complacency is a serious issue, as it leads to inadequate preparation and, ultimately, higher rates of infection. The key to preventing these diseases is vigilance. As Dr. Quimby advises, performing tick checks on oneself and pets after exposure to potential tick habitats is essential. However, even this step is not foolproof. Ticks are small and often difficult to spot, making thorough checks critical to preventing infection. And when it comes to mosquitoes, the best defense is not just wearing repellent, but also avoiding areas where mosquitoes are most active, particularly during dawn and dusk. Additionally, the widespread misinformation about the risks of tick and mosquito-borne diseases only complicates matters. Some individuals still believe that these diseases are rare or not serious enough to warrant precautionary measures. This ignorance is deadly. It prevents people from understanding the severity of the potential long-term effects of diseases like Lyme disease and West Nile virus, which can include chronic pain, fatigue, neurological issues, and even death. The reluctance to take these threats seriously and the underestimation of the risks only increases the chances of widespread outbreaks that could have otherwise been avoided. While the presence of ticks and mosquitoes may seem like an inevitable part of the warmer months, it's crucial that we do not let this familiarity breed complacency. We need to take more robust action to protect ourselves, our families, and our pets from the dangerous diseases these insects carry. It's not enough to simply acknowledge the risks. We must actively engage in preventive measures and educate ourselves on the real dangers that come with these bites. Ignoring the warnings or neglecting to follow safety guidelines could result in a lifetime of suffering from diseases that were entirely preventable.